Hey, Doc Testa here, Chief Health and Wellness Officer for Pine Pollen Superfoods and trained for longevity. And in today's video, I want to talk about ibuprofen and how it may be affecting your testicles. Now, interestingly, there is a correlation between taking ibuprofen and lower function of cells within the testicles, and this didn't always result in a decrease in testosterone, probably yet, but it does result in something that's called compensated hypogonadism. And so what happens as you take these things, ibuprofen in particular was in this study, it can affect the ability of certain cells within the testicles to produce what they're meant to produce. And the message from the pituitary gland releasing luteinizing hormone, it basically has to yell a lot higher, a lot louder to get the testicles to do their job. So there's this imbalance between luteinizing hormone and testosterone. Now, in some studies it showed testosterone levels didn't decrease. In other studies it showed sexual desire didn't change, but erectile function did, muscle mass did, the ability to maintain a normal, healthy mood. In one study I saw there was an increase in anxiety and obsessive compulsive type behavior. So it's interesting, and as the testicles start to not respond well to luteinizing hormone, one has to wonder what are the long-stream effects of this, of where there's this reduction in this communication between the pituitary gland and the testicles. Now, as we get older, of course, we have musculoskeletal pains, and so we take this stuff sort of willy-nilly, thinking that, oh, it's over the counter, it must be safe. But the fact is, non-steroidal anti-inflammatory drugs are not safe, and if you look at the American Heart Association, there's heart attack risks, there's certainly bleeding risks associated with this, and inflammation is the first line of healing in our body, and so every time we blunt that, we stop or alter or change the ability of our body to heal itself. So maybe it's time to, one, figure out what you're doing that's maybe hurting your body. Like, are you lifting too heavy? Are you lifting too much? Are you lifting overhead when you shouldn't? At my age, I don't do too much overhead because I've already got a rotator cuff issue and a labral issue, and there's just no real reason to push that. I do other things. And so maybe that's something to consider. Also, other things to consider too are regenerative medicine procedures. PRP, platelet-rich plasma, or bone marrow concentrate stem cells are also really good solutions at addressing these problems. Of course, before going to that, you should try conservative measures like chiropractic or acupuncture or dry needling. And there's a lot of nutritional supplements that can potentially help you move with less pain, but I'll cover that in another video. So when you're thinking about reaching for ibuprofen in particular, be careful because you may have downstream effects suppressing function of certain cells within the testicles, making your pituitary gland have to yell at a higher level, releasing more luteinizing hormone to get them to work. And again, testosterone levels may or may not be affected, or may be later on down the line, but other effects such as erectile dysfunction could ensue, as well as mood disorders. And also in this additional study I saw, and I'll put in the show notes here, increase for cardiovascular risks. So, again, we just got to be careful with this stuff, find better ways of dealing with our pain. I hope you find this helpful. Please subscribe to our YouTube channel below, and I'll see you in the next video.